You're listening to the Keeping Abreast with Karen podcast, brought to you by the Karen T. Stahl Research and Breast Institute. Today, it's Thankful Thursday, and we're joined with us by Dr. Maureen Hecker-Rodriguez of East Jefferson. Dr. Hecker-Rodriguez, affectionately known to our family as Dr. Mo, has been with us from the beginning. And when I mean from the beginning, I mean all the way back to Mom's breast cancer journey. So Dr. Mo holds a very special place in our heart. She's a wonderful healthcare professional, and you're really going to enjoy this interview. Without further delay, here's Mom and Dr. Maureen Hecker-Rodriguez on Thankful Thursday.
Welcome to another episode of Thankful Thursday. Joining me today is my very dear friend, Dr. Maureen Hecker-Rodriguez, specializing in internal medicine and medical physician at the Center for Wellness and Longevity, a division of East Jefferson General Hospital in Metairie, Louisiana. Dr. Mo is also the physician who navigated my breast cancer journey some 19 years ago and has been an avid supporter of KTSRBI from its inception. Welcome, Dr. Mo.
Well, thank you, Karen. You know, I'm here anytime you need me. You have a very special story and a message to put out, and I'm there for you.
Well, thank you. You have been a huge reason why I'm still on this side of the grass, and I'm sure some people are appreciative of that, some not so much. Particularly, I don't think cancer is very happy that we got through that, because we've been after them like a dog on a bone. So let's talk about your medical career, because you have an interesting story, and we want you to talk about your present practice and how it is beneficial for those going through a cancer crisis.
Well, so I have a very different pathway to medicine than most people. I decided to be a nurse first, and mainly because of intimidation by my own family. I'm the youngest of 9 children, and 5 of us are doctors, so it's not very easy to be the tail end of that crew. So I started my career as a nurse, and as I got further along, I decided that I wanted to do more. So I went back and pursued my medical degree. I love being an internist, but I always felt there was something more for patients, and I hated being a pill pusher. So I wanted an option for them. So I trained in acupuncture. So I do not only internal medicine, but I do medical acupuncture. I'm one of the few internists that, or actually medical acupuncturists that just don't do pain. So I work with a lot of different medical modalities and different medical diagnoses. So we can work with not only pain syndromes, but we can work with sleep, we can work with anxiety, we can work with reflux, constipation, anything that can be treated in the body through the use of needles and ion channel balancing. So I do some other things with acupuncture. So it allows me to be able to treat patients Western first, but always have another door to open up to them, so that it's not always big pharma and pills, because a lot of people don't want to be on medications, and we want to avoid putting patients on detrimental medicines such as opioids and other things. So that's
an
kind
excellent point.
Yeah.
Our country's gone through a terrible opioid crisis, and people are looking for alternatives to relieve pain. And sometimes those pains are very vague or indescribable, but acupuncture can be used to locate where the source is coming from. Can you talk a little bit about the difference between your acugraph method and, say, dry needling?
Okay, so acupuncture is the use of acupuncture needles. Usually you can do a non-needle method to work with energy flows in the body, which are called meridians. So I'll go into the dry needling in a second. So I have a way to take technology with the ancient art of needle placement and look at the energy flows in the body. So in the 1950s, actually, the Japanese started to do some studies, and they started looking at energy flows. There's something, meridians you cannot measure per se. And that's one of the issues that Western medicine has a hard time recognizing Eastern medicine. But the Japanese started to do studies through oscilloscopes, and they were able to look at energy flows through our bodies. We're made up of protons and neutrons. That's how MRIs work, and how we do work with CT is we make images out of different ions in the body. With the use of an artificial intelligence, by just using your hands, the wrists and the feet, I'm able to kind of look at the dipsticks or the wells of the 12 main meridians in the body. Through that technology, I'm able to see where stuck energy is. And from that, I'm able to actually attach, I can attach diodes to my needles, and I can move that energy. So we take the ancient meridians, we put the newest technology together, and we have super acupuncture. When you talk about the dry needling is really only use of needles, and it's only used for spasmed areas or areas of stuck energy that are clumped together. Meridians are rivers, and so I can actually treat a patient who's having head pain by working with their feet. Dry needling has to go directly to the point, and it's usually very painful. The problem that we have, and the problem with acupuncture in general, is that Western medicine doesn't recognize it, and of course insurance companies don't pay for it. But dry needling is paid for by your physical therapist and your insurance company, because it's cheap, it's quick, but it's not as effective as it could be. So, we've just got to get the government to realize we have, this thing's been around for 5,000 years. It's worked, and we don't have to use a lot of medications. We just have to find a way to put it all together and integrate the two together. And so that's kind of what I do in my practice, is Western first, but we got that Eastern door to go into, and we can treat the patient holistically, physically, and psychosocially. And that's the difference with Western medicine. It's just going to give you medications and try to help you out other ways. And for your cancer patients, it's not just their cancer they're dealing with. They're dealing with all kinds of things. The psychosocial is just as important as the cancer itself. If you don't have a good attitude treating your cancer, you won't treat it. It's very difficult.
And that is the way it works. And I've had personal experience with your acupuncture treatments and had great success in pain relief. And I have a sensitivity and allergies to most pain medications. So acupuncture was a fantastic alternative for me. And it isn't painful. In fact, it's kind of like treating yourself to a spa day. It's wonderful for your mind as well as getting relief from pain. What
Right.
other services do you guys offer at your office?
Well, I have a unique practice. I'm in what we call a concierge or membership practice. So we do insurance, plus we have membership on top of that. So we have 24/7 access to physicians. I have the most awesome staff that works with my patients, and we are there for the patients. I'll tell you, during this COVID crisis, being able to get to your doctor at any time of the day is extremely important, especially when we have a disease that we don't have any cure for. So we do membership. We also have a masseuse in our practice. So we call that our spa services. And then we have the acupuncture, which is also a spa service. But our whole goal is to, actually, it's old-fashioned medicine the way you used to get it 30 years ago, but in this day and age, you can't. And so the membership is very affordable, and it allows patients to have a doctor that actually knows them inside and out. So when my patients call, I already know who they are, know what their histories are, and may have to tweak a little bit on medications, but these people I've spent time with, and I'm not rushed. So that's the beauty of, it's called the Center for Longevity and Wellness. We're a division of East Jefferson General Hospital. Very unknown to most people that we even have this service available, and it's open to anybody who wants to be in it. It's a way to be able to take control of your medical care.
It is wonderful, and I have found it particularly useful with you being able to treat my mom, and I don't have to worry about if she's getting her information correct, or with you in particular, you're so good at looking at the whole patient's history and not just randomly writing prescriptions, or as you said earlier, pushing pills. I know that she's getting a complete treatment that's best for her.
Right. And we're looking at diet. We're looking at what's going on with, if you don't look at what's happening with the patient, you get that small window of time that you spend with them. they're not going to tell you, hey, doc, I'm only getting 2 hours of sleep and all this. And sleep deprivation, stress, everything plays into how you treat the patient. Also, are they not taking their medications? I don't ever call a patient a non-compliant patient. There's a reason patients don't do things. So it's just kind of spending the time and finding out what's going on with them, looking at their diets. A lot of times people are, thinking they're eating healthy and they're actually eating foods that are just really, doing numbers on them. And it's just a matter of education, the importance of exercise, and the importance of the mindfulness, and making sure that you have good mental health too.
And that's refreshing to know you have your doctor's attention, and
yeah.
you're very, very sensitive to listening to the patient and actually hearing them and treating them subsequently.
Right. I have a question for you, Karen, since
Sure.
We started our journey many, many years ago. I embedded into my brain is the day that you walked in saying, I have this lump, I've been exercising and I just found this. And that started us getting you railroaded in a time when we didn't have, membership type services. I made sure that you got where you needed to go very quickly.
You did.
What could we do as physicians better when we have patients, especially breast cancer, comes up? One of the things that I do not do is I don't like to tell patients on the telephone. Sometimes it's unavoidable because they're so worried about a diagnosis. But if I need to get them into an appointment tomorrow, sometimes I have to talk to them about that. But what can we do as physicians to help patients with that shocking news? What would you have liked to have seen, or what are you seeing in the people that you have touched? Because so many people have a negative start with this, and we just don't want it to be that way, especially with breast cancer.
Oh, that's a great question. It's so hard to not feel pummeled when that news is delivered, no matter how delicately it's delivered, or how callously it's delivered. You're so blindsided, and really, I was talking with Dr. Corsetti about this a little earlier today. The best advice I think you can give someone who you have to give this word to, or this unpleasant news to, is make sure they have someone with them when the news is being delivered. It's someone who can take notes, who can pay attention, because once you hear you have breast cancer, you hear nothing else. You hear nothing. The floor beneath you is just completely shattered, and you're just blindsided. So really, that's the best thing, to give the news as gently as possible, as confidently as possible, because you and Dr. Bernard were wonderful when you did tell me that you were confident and certain that it was something we could battle together, and that it was a winnable war. So that gave me the fuel I needed. So those two things, I think, confident with your patient and gentle, and make sure they have someone with them to take them home after that.
Well, that's the other beauty of our practice, is that you're given our cell phone number. So my patients, when I have to deliver that news, my big thing is, you're not going through this journey alone. You have a question, you text me, you can call me. That's part of our services here. So that's what's very different from another doctor's office.
Yes.
And knowing that you have that person, and I've had multiple patients call back, well, I just have one more question, and I spend the time with them, because I know that that's news that I don't like to give.
Right.
It's difficult for doctors. We don't think about it from our standpoint, but it's hard, because then I go home at night and worry about that patient.
And you genuinely do. I know patients who have awakened in the middle of the night to you holding their hand in the hospital, and that is a remarkable quality about you. And we appreciate you and love you for that.
But so my mission, what I've done from my experience with you, is we demand 3D, but I also make sure, my mission is to make sure women know how to do a proper breast exam, and the importance that breast cancer doesn't always have to have a lump. So big things are making sure you feel comfortable with your body, that you're looking at yourself, and then you have an avenue to get things checked out when you need to. But I don't use your name, but I use your example all the time. My own mother-in-law died of breast cancer, very near and dear to my heart. So it's something that is, I'm on a mission from God, as we did from the Blues Brothers, but that's what I'm here for. I'm on my mission.
No,
for
it's
God.
true. It's
Yeah.
definitely been our mission, and you've been a great partner in that mission. And
Yeah. And I will continue to be there until you kick me out. So
no, you're jumped in. It's too late.
yeah, I know. So
Well, how can people get in touch with you and explore acupuncture for themselves, or get in touch with you so that you can be their doctor?
So we have two avenues that you can do acupuncture. You do not have to be a member of we call it the Center for Longevity and Wellness, which is called CLW. You do not have to be a member to do acupuncture. You can come in and just do acupuncture alone. And the contact number for that is area code 504-885-7360. Or if you become a member, then you get discounted services for that. So that's and then membership is membership plus your insurance, very affordable, and that can be discussed anytime anybody wants to call. You can look through East Jefferson's website, but in general, it's area code 504-885-7360. And I can get anybody information. I can get some stuff if you want to put it on the website or anything like that. We can get that information for you. But
I strongly urge our listeners to try your services because we talk about integrative therapies and alternative therapies, and I always want to reiterate, it's not instead of chemo or radiation, it's in complement to. And I can only say how much it's worked for me and urge others to try it. And I hope they do, because it does work.
Yeah, and it's a different way. It's sometimes you can't explain what the pain is. It's a visceral pain that you walk away after an acupuncture treatment, especially a balancing treatment, and you're like, wow, you can be either very energized or you can be very drained, but your body, you see responses. And I love it because I get instantaneous response from patients. So
it's true. You can feel it happening. It's an amazing process.
Right.
5,000 years can't be all wrong.
Right. No, and it is something in this day and age we need to start looking at, especially things like the COVID, where we have no cure for anything. We need to be able to give patients peace of mind, or patients who can't tolerate other medications. There's not an end of a road for them. There's other options available. It's just you got to go search for it.
Yes.
And so that's one way we can do it.
True. Well, thank you for being with us today, Dr. Mo. We love you.
Thank
and
you.
We're going to have you on again because you are a fun interview and
perfect.
You have a wealth of information.
Well, I'll be looking forward to it. And we want to demand 3D. So keep it up.
Yes, indeed. Thanks, honey. See you soon. Love you.
Right. Bye. Love you too.
Bye-bye.
Thank you again for joining us on the Keeping Abreast with Karen podcast on another Thankful Thursday. Be sure to follow us on social media at Karen T. Stahl 3D, and that's Twitter, Facebook, Instagram, LinkedIn, or YouTube, or go to our website, www.ktsrbi.org. If you enjoy the podcast, hit subscribe and leave us a review wherever you get your podcasts. We're all in this together. Remember, demand 3D.